Here we're looking at nebulizer therapy. I've got a nebulizer compressor here that we are going to go over setup with the nebulizer cup. Nebulizer therapy is the idea of using a liquid medication that is placed inside the nebulizer cup and then attached with tubing to the nebulizer, which forces air into the nebulizer cup and makes a mist, a fine mist out of the medication so it can be breathed in. So we're going to go over the setup, and we'll start just by looking at the compressor. This is an air compressor. Most air compressors are just AC powered. In other words, they have to be plugged into the wall. There are some battery operated ones out there. This is an AC powered nebulizer. If we look at the front of it, you can see that it's got a power switch here. Give it a turn on. That's commonly what they sound like, an air compressor. Air outlet is right here. You can hear the air coming out. On the side, there's a vent that needs to stay open. And then there's an intake filter here. Now the intake filter does need to be changed from time to time. It takes quite a while for them to get dirty. Nebulizer treatments typically only last about 10 minutes, so it's not on and running that long. But it looks like this, almost looks like a nail kind of a shape. Fits right in the opening here. And just change it whenever it's dirty. They're white, so it's real easy to tell when they start to get dirty. Just take them out and throw them away. They're not washable. So take it out and throw it, and get extras. They just pop in just like that. Pretty straightforward. So that's our neb compressor. The accessories that go with it, typically you'll get a neb kit. And in the neb kit, many times what you'll get is the tubing, the nebulizer cup, and a mouthpiece of some type. Now this varies. Yours may look a little bit different, but chances are it will work very similarly to this one. So we'll go ahead and get this one hooked up. I'm going to take the tubing. On most of the tubings that you'll have, the ends are going to be the same, so it won't matter which end you use on the machine and which end goes to the neb cup. But you'll just put it on like that. Next thing we'll do, if you're going to put medication in the neb cup, it's best to, just so you don't spill it, it's best to have it placed on the table. Your medication goes right down inside that neb cup anywhere in there. Just typically around the outside edge, you can just squirt it right in there. And then you can put the cover over the top. Once you've got the medication in there, make sure that it stays upright. Of course, you can tilt it and pour it back out again. So you want to keep it upright now. And then your tubing attaches to the bottom. So on both the end that goes to the machine and on this end, just push it in there, kind of wiggle it back and forth to get it to stay on there snugly, because there is a little pressure as the air pushes it in, forces it through the medication. So you want to keep it snug on there so it doesn't pop off. Then, depending on the type you have, you may be using a mouthpiece for it, or you may use a mask or other adapters. So I'll just show you right here. The mouthpiece will just fit on the top like this. Doing the nebulizer treatment, the best thing to do, go ahead and start your nebulizer and then breathe in. And when you breathe it in, make sure that you hold it in your lungs for just a little bit, then exhale, and then go ahead and take your next breath. Be careful not to hyperventilate. If you start getting dizzy, slow yourself down. But you can just keep breathing back and forth. This mouthpiece happens to have an opening here, so you can leave it in your mouth if you want. Inhale, exhale. Otherwise, breathe in and take it out and exhale. That's one option. Another way that it can be attached, you may have a mouthpiece that uses a T-adapter. A T-adapter fits on like this. Many times it'll have an end that's a little bit smaller on one end and bigger on the other end. And you'll just attach a tubing on the back, and then you'll put another mouthpiece on the front. Now the reason for the tubing in the back is that it acts as a reservoir. So as it's on and working, and you'll draw the medication out of here, in between breaths, it will store medication inside this reservoir tube. And then when you take your breath, you'll draw that out of there, plus what's coming out of the nebulizer at the same time. So that's another option. And then we can use a mask. A mask will fit in there, and these masks can be pediatric in size, or infant, or adult, as this one is. And these just fit on like so, and the patient can just use the, or strap the mask on and take their treatment. Like I mentioned before, treatments take about 10 minutes, and you'll just keep going, leave the nebulizer running until all the mist is out and all the liquid is gone on the inside. Sometimes if you shake it a little bit or tap it to get the medication down there and all used up, and after about 10 minutes you're done. So what's recommended for cleaning is that you, after your treatment, disassemble it. And one part that you want to be very careful of not misplacing is the baffle on the inside. So when you're done, if you tip it, sometimes you need to grab that baffle and actually pull it out. This one falls out very easily. But this needs to be washed, the cup and also the top. And they can just be washed in warm soapy water, dish soap. Rinse them very well and then let them air dry. All right? So then you can put it back together when they're dry, and then you're all set. You can use it next time. As far as troubleshooting with the nebulizer, some things you want to look at. If you're not getting a nebulizer or the mist out of the nebulizer, two main things that can be the problem. Number one, you'll want to isolate, is it the compressor or is it the nebulizer that's causing the problem? So initially, make sure your connections are good, make sure your connection is good here, make sure your connection is good under the neb cup to eliminate that. And then check your nebulizer machine to find out if that's the problem. So an easy thing to do is just turn it on. Make sure you can feel good airflow coming out of here. You should be able to feel the air, feel a little bit of pressure behind it so you can tell it's going to push through. So if it sounds like that, it's probably in good shape. So it's probably not the nebulizer causing the problem if it sounds like that. The other issue that can cause the problem is, if we take this apart, are you missing the baffle? And this happens sometimes if you wash it, maybe it falls in the sink, or you leave it on a towel where you were letting it dry and you forgot to put it back in. So this needs to be in there in order for the nebulizer to work. That has to fit in there. The other thing is that in this cup, there is a very, very tiny hole right here for a jet nebulization to take place. It's really hard to see, but it's like a pinhole. And that pinhole, if the nebulizer is not cleaned regularly, it can, some of the saline or the medication can dry in there and plug that hole. And if that happens, best thing to do is just replace it. So that's a good time to get a new neb cup and replace that. But that's usually the cause, is that little jet being plugged in there. So then if you replace that, if you found your baffle, you can put it all back together and hopefully that'll work. Like I said, if the baffle is in place, but you're still not nebulizing it, chances are it's that little jet that's covered, then you'll need a new nebulizer.